As of now, Ebola has reached Congo's largest eastern city, Goma, with authorities confirming the first case in the densely populated urban center. The infected patient had traveled from Ituri province and is currently in isolation, raising fresh fears of rapid spread.
In truth, we are truly afraid of this Ebola epidemic. We've been hearing about Ebola for several years now, first in Equator province, then in North Kivu, and now here in Goma, which is truly heartbreaking. We are asking the government to implement measures because we don't know what to do. The insecurity is already a problem, and now this disease has added to it.
Residents in Goma say fear is rising sharply as the outbreak enters a conflict-hit city already struggling with insecurity and displacement.
I'm very scared because we have heard about Ebola in previous years, and now we're hearing that Ebola is in Goma. I'm calling on the local authorities to intervene because we're also scared because of the war, and now because of Ebola. We're really scared.
Rebel authorities controlling parts of eastern Congo have urged calm, saying they will enforce preventive measures and manage suspected and confirmed cases as the situation evolves.
We will first protect the populations under the space we manage, and we ask that the populations carry on their daily business. We have the mission to manage communication well and inform our population, raise their awareness, give them preventive measures and barrier measures, the practices that must be observed, and then we will take care of all suspected cases and cases already confirmed, and even take care of, if there are deaths, how to take care of funeral ceremonies and everything that goes with them.
The World Health Organization has declared a global health emergency over a fast-spreading Ebola outbreak in the Democratic Republic of the Congo, now crossing into Uganda. Over 300 suspected cases and nearly 90 deaths have been reported, with officials warning the real scale may be higher.
As of today, there are near 246 suspected cases, and we have recorded a total of 80 deaths, both in communities and at health centers.
Authorities say the outbreak is driven by the Bundibugyo strain, a rare Ebola variant with no approved vaccine or treatment. It spreads through bodily fluids and can kill up to 50% of those infected. Early symptoms resemble flu or malaria, allowing the virus to spread silently before detection.
It's Ebola, but this time it's the Bundibugyo strain, a strain already known to have spread in Uganda and which previously caused an outbreak here, notably in Ituri in 2012.
Officials say the outbreak began inside communities, where early cases were misread and treatment delayed. Traditional burial practices and dense population centers accelerated infections, turning isolated cases into a wider crisis. Health teams now warn delays allowed the virus to spread before containment began.
Ebola, was generated at the community level without going to health centers. People in the communities said it was witchcraft or things like that.
Uganda has confirmed Ebola cases in Kampala, including a patient who died after arriving from Congo. Officials say the cases show no direct link, raising fears of multiple transmission chains. Fear is rising as memories of past outbreaks return.
I buried my father during COVID. It was a similar disease that killed him. Now, as I lost my father to a disease like that, like Ebola or COVID, I really get scared because I remember burying my father without looking at his body.
The outbreak is centered in eastern Congo's Ituri region, where conflict and poor infrastructure are slowing response efforts. Aid agencies are struggling to access affected zones and trace contacts in time.
We are also talking with people who are in conflict for them to understand that they need to give us access because we are not part of the conflict. We are there to support the population. We already did it in the past, and this is the approach that we have. From our side, we are making sure that we have all tools that we can bring. From their side, we are looking for the understanding to give us access to support people.
The WHO says this is not yet a pandemic, but with a rare strain, no vaccine, and cross-border spread, the warning is clear. The world has been alerted. The question now is whether it responds in time.